Thank you, Chair, for the beautiful introduction. And thank you, Dr. Correa, for inviting me. As I've already been introduced, that is the work that I'll be doing. I am sorry, my network is quite unstable. If it gets too unstable, I will request to present without my video. But so far, for now, it seems okay. Let's just go there. I don't know if my presentation is showing that side.
Yeah, it's showing, but I request you if you can.
It's not on the slideshow.
Slideshow. Perfectly fine.
Thank you so much. The purpose really of this keynote is for me to share the historic milestones that we've been through in this journey in South Africa, in the development and advancement of forensic nursing in South Africa. And I will do this by focusing on what we've done in terms of our education and training, as well as in practice, specifically looking at the pragmatic approach that we used in advancing forensic nursing practice. And then, of course, I will share the lessons of our experiences. The historic milestones starts exactly in 1998, when Virginia Lynch and 13 other forensic practitioners visited South Africa. The next one would be in 2003, which is legal definition, when we started having legal definition of forensic nurses. And what is important about 2003 is that it's also the year that I was introduced to Virginia Lynch when I visited the States when I was studying at Johns Hopkins University. And then, of course, I will talk about the birth of South African Forensic Nursing Association, which was in 2013, and then where we are right now. I would be presenting around those milestones. So historically, it will always in South Africa start with Virginia, but of course she was working with some of other American forensic practitioners from the US, but on our side, she was working with Dr. Tromp Els, who was a senior district surgeon at the time. That's the time when forensic nursing was introduced in this country. And they piloted training of forensic nurses, starting with 24 forensic nurses who were trained in Kimberley, one of our major cities where diamond was first discovered, and also 40 forensic nurses who were later trained in KZN, which is a province where I am. So at that point, somebody, one of the journalists put this on the newspaper as what was the purpose of this training. However, when we looked at it, we realized that was not totally what we believe forensic nursing is, as you would have seen how Virginia later on was quoted verbatim saying that forensic nursing should provides an exploration of forensic aspects of healthcare, including principles and philosophies of forensic science, forensic pathology, bioethics, victimology, traumatology, sexual and domestic violence, medico-legal documentation, and rules of evidence, and toxicology, which was more in line with also what the American Academy of Forensic Science, how they explained or defined forensic nursing in 1991. So there was a little bit of a shortfall in how that particular journalist defined forensic nursing in South Africa. However, we were happy that it was already being written about even on newspapers. And this was one of the other newspapers which spoke about this being a first on the African continent. And we're excited about seeing this also on the newspapers. And of course, I can never present anything about forensic nursing in South Africa without presenting these two. Of course, they may look different right now, but I'm glad that Virginia is here and she's smiling at me and she still looks the same. This is Dr. Tromp Els, whom we consider as father of forensic nursing in South Africa. And this is, of course, our dear mother of forensic nursing in South Africa, that is Virginia Lynch, who also happens to be a dear friend of mine. So this picture really is of the people who were trained in 1998, which I got on one of the archives, because since I became aware of forensic nursing in the early 2000s, I started following and digging anything that I could come up with, especially after 2003, when I had met Virginia Lynch and when I was studying at Johns Hopkins School of Nursing. The ones that I've highlighted in red, of course, are the people that I've met and communicated with and engaged with through Virginia. Yes, this guy was one of the first nurses that were trained in Kimberley by Virginia Lynch. I'm sure she won't recognize him now because of the next picture where he was nice and young and looking differently. But be assured, Virginia, this is Mohau Mahosane, one of your first students, and he has not left forensic nursing. At the moment, he's serving as a director in forensic. He's currently serving as a director of clinical forensic medical services in Gauteng, which is one of the provinces in this country. So in the next picture, maybe you'll recognize him in this other picture, because that's how you probably would have known him. Again, this is one of those old magazines that or newspapers that I had to dig and find just to come and indicate how far we've gone. That is the same man that I've just shown you when he was this was in 1998, but the earlier version was just last year. And this is the place where he started working as a forensic nurse. It's one of the first sexual assault response team clinics in Kimberley, where under Dr. Tromp Els, Mohau worked. And this is another nurse who was trained, the first nurse, forensic nurse who was trained in Durban when Virginia and her colleagues were here. She's a nurse educator and a GBV activist. She has retired now, but she remains a very active member of the South African Forensic Nursing Association, and she's also an executive board member for the KwaZulu-Natal Forensic Nurses Forum. She also happens to be a dear friend of mine, because I'm trying to take a baton from all those people who have gone before me. There were quite, after the training that was introduced, piloted by Virginia and Dr. Tromp Els, a number of NGOs, that is the non-governmental organizations, as well as universities, started providing certificate training programs in forensic nursing in South Africa. One of those was the University of Free State, the University of KwaZulu-Natal, and the University of Cape Town, where I was based, and the University of Pretoria. However, all the graduates from these programs were never formally recognized by the South African Nursing Council, because as part of the recognition by the South African Nursing Council, one has to be registered against a role or an act which has been enacted to accept that additional qualification. However, at this time, all along, this has not been the case until later on in the program. So later on, all these universities that have the stars decided to discontinue the program. so that while we were waiting to realign with what the South African Nursing Council was doing in the background. So as I indicated that in 2003, we had a legal definition of forensic nurse, first legal definition. It is on the National Health Act of 61 of 2003, under the regulations regarding rendering of clinical forensic medicine services, which was later amended in 2012. It defines forensic nurse as a professional who is registered with the South African Nursing Council, trained in forensic clinical medicine, who is authorized to examine, take forensic evidence for investigation, and provide counseling and testing for the victim of sexual assault. Again, slightly limiting, because it's only limiting it to victims of sexual assault. Limited as this legal definition was, it gave us courage to forge ahead and start the process of compelling the South African Nursing Council to recognize forensic nursing as an additional qualification, because now we were saying we have an act that says this person has to be recognized by the South African Nursing Council. So you, Nursing Council, you need to do something. And of course, the nurses who were trained in those institutions were also knocking on South African Nursing Council's doors, wanting to be recognized and wanting to be registered. So that is, in a way, that really helped us, because we could then go to the Nursing Council with that. However, the Nursing Council advised us that they could not entertain individual people who were coming, asking for registration or asking them to recognize forensic nurses. So they advised us to develop an association or a voice which could come as a group and work with them in the development of forensic nursing competencies. This we took into our stride, and we worked with them, and we developed those competencies. This is just where I'm sharing how since 2013, after that advice from the Nursing Council, we developed the South African Forensic Nursing Association, which became the voice of forensic nurses, irrespective of what level of training they have received and wherever they've received it, focusing on voicing out the issues, the needs of these nurses, but also preparing or providing training, as well as some research to an extent. I like this because we also published this in the International Association of Forensic Nurses website. If you have time, you can get to that and read more about the birth of SAFNA in South Africa. And of course, later on, through working in close contact with the South African Nursing Council, we reached this milestone, which I consider as a pinnacle in the development and advancement of forensic nursing education and practice in South Africa, because finally we were now recognized, or let me not say we, let me just say forensic nursing was finally being recognized by the South African Nursing Council, which is our national professional regulatory body. And through the work of South African Forensic Nursing Association, we developed these nursing competencies or nursing outcomes, nursing education outcomes for a person who is being prepared in the postgraduate diploma, at the postgraduate diploma level. We call them exit level outcomes, postgraduate diploma in nursing. These can be downloaded by any nursing education institution, be it a university, a college, public or private, which wants to develop a curriculum in postgraduate diploma. They have access to this through the South African Nursing Council website. So this for us was a pinnacle of our work. And of course, we continued, we didn't just rest from there. since the people who were trained, they didn't just think that just because the South African Nursing Council was not recognizing the qualification, we didn't just sit on our laurels. We started developing nurse-led, forensic nurse-led practice, where we looked after the victims, mostly the victims of sexual assault, but also any other victim of violent crime. Pragmatic response to a shortage of doctors to care for the victims of violent crime in the country. There was also at that time an increase in the crime statistics, especially increase in rape and gender-based violent crimes, which later led to us, or the country, being dubbed the rape capital of the world by Interpol. So there was a need for us to not just rest, but develop the nurse-led practice, even if we were not recognized by the South African Nursing Council. This, of course, was done because of the assistance and the support from most of the forensic specialists, the doctors, starting from Dr. Trump Els. I've seen Dr. Steve is also in this, Steve Naidoo is also in this conference, but also Dr. Seki Naidoo, and many others who really believed in the forensic nurses to be able to provide a quality nursing care to the victims of violent crime. And of course, it was also a pragmatic response to what the World Health Organization has done, because at that point, around the 2008, the World Health Organization had made a call to all the countries to adopt what is known as task shifting, which is a process of moving specific tasks where appropriate from highly qualified health workers, for instance, the district surgeons or the forensic specialists, to health workers with fewer qualifications for more efficient use of the available human resources. At that point, they were only regarding this for HIV and AIDS, but we also are aware of the intersection between HIV and AIDS. So for us, we just piggybacked on that call, and that is how we looked at task shifting towards the provision of forensic nursing to our patients. And some of the principles that we really adopted was coming from the World Health Organization principles, was moving from the highly qualified doctors, in our case being the district surgeons or the clinical forensic medical doctors. At first, they allowed any other non-clinical medical doctor to do this. However, even those could not handle the increase in the victims of violent crimes and trauma. So the task shifting moved, the tasks were moved to professional nurses, hence the trained forensic nurses coming to the fore. We also, this was made possible by adopting the principles of task shifting, regulating what was to happen, supervision. I've already spoken about how the doctors came to the fore and provided supervision to these nurses, delegation, mentoring. We are still up to now being mentored. Our nurses are still being mentored by some of the doctors, and innovation, because looking at a qualification that has been non-existing and then bringing it to a point where a professional regulatory body accepts it. It takes innovation, but it also takes resilience on the part of those nurses, as well as those people who are interested in helping them. We also made sure that as forensic nurses, we were visible in many platforms. This picture looks like someone you may have already recognized. This must have been some 2015, 2016, where she presented her work. That's me, by the way, as a forensic nurse, but working for the university, where we were talking about the first campus sexual assault response team that was looking at the victims and survivors of violent crimes in the universities. This was on one of the national television stations. just making sure that we are visible. And we also have advanced forensic nursing education and training by becoming visible in all spheres here, and also developing scholars. Here, the guy that I've highlighted in red is one of my PhD students. He had to present with other people who are doctors mostly. And his work is he's looking at the medical education. He's looking at clinical forensic nursing, particularly in the care of male victims, boys and men. So those are the things that we've just been trying to make sure that our voice, our faces, everything is known out there, that forensic nurses are there in this country and they need to be utilized at all levels. He is doing PhD, so he can also be utilized at higher education level. So our lessons really has been that developing and advancing forensic nursing science and practice is a long and tedious journey, but it can be done. We've already seen how it was done in India, but we are just reinforcing that it can be done if we all care about the quality nursing care for the victims and survivors of violent crimes and traumatic accidents, if we care about the development of generations of forensic nurses and scholars globally. So as long as we still have people like Virginia Lynch in our midst and in our countries, we can all stand up and be counted in the development and advancement of forensic nursing science in our individual countries. As part of conclusion, I just want to quote this adapted quotation from somewhere else. I think it's Isaac Newton, who said, so I've adapted it. So I'm saying that if I, Sineku Budoma, have seen further than others in advancing forensic nursing practice in South Africa, it is because I've been standing upon the shoulders of these two giants. You too can do it. I thank you.